Qualcast Nation, there's very few times I come on here that I'm this excited to cover a topic, folks, because this is real. This conversation we're having with Dr. Nick Fabiano is going to open your eyes in terms of taking the power back when it comes to our mental health, the importance of exercise. It's so, I'm totally jazzed up. So, Nick, welcome to the show, my friend.
Yeah, thank you for having me.
Absolutely. So, you're young in your career. You clearly saw an affinity for looking at mental health and exercise. Maybe let's start with like what drew you to this link.
hmm Yeah, I think there's a few things. So, as myself right now, as a third year psychiatrist, and I've always been really interested in kind of that overlap between mental and physical health. And one thing that I noticed is my own bias coming in. I've always been someone who played soccer, went to the gym. I really like that sort of things. And anecdotally, throughout medical school my whole life, I just noticed that exercise was so beneficial to me, both physically but mentally as well, too, provided that sense of clarity. And I always wondered when we're seeing these patients, we have this dichotomy between mental and physical health. And from the psychiatry side of things, oftentimes we don't really fully pay attention to the physical side. And I thought that was really, really interesting and interesting, but also kind of problematic. So as I started to see more and more patients, I thought, why don't we have an intervention that we can help with both sides?
Mm.
And something that has the unique position of that is exercise, right? If you can get people to exercise, get moving, it can help with their mood, it can help with the physical ailments that come with it. And we know that if we're speaking about depression, for instance, that's something that's very highly comorbid with a lot of other physical ailments, and they go hand in hand. So that's where that idea really came from first. And then the other arm of it too is the medications we use. They have a lot of metabolic burden to them, and by that I mean a lot of weight gain associated with it, a lot of issues with controlling your sugars, and sometimes we follow up the blood work. We kind of follow those things, but we're not directly tackling some of those side effects. So I think it's a responsibility for us as physicians to address both sides. So I think for both of those reasons, it really got me interested in looking at the field of exercise to kind of both help treat but also prevent some of these side effects from medications that someone might be on, and looking into ways on how we could do that better.
Boy, do I love this. I've been a big believer of movement is medicine, and not only for the physical side, but the mental health side. And you're part of that solution in terms of creating that evidence to suggest that. So give us a sense of like, has this been studied? Has this been looked at? Whether we're talking depression or any other mental health disturbances, like what's the level of evidence that's out there that exists?
Yeah, that's a great question. And I think it's an area that's been rapidly and rapidly growing more recently. If you were to look at this, say, 20 years ago, and you said, I'm going to prescribe someone exercise for depression, for instance, they'd look at you like you're crazy, right? And over time, though, the literature has built up more and more and more, which is good to see because we have more solidified evidence to really see the antidepressant effects of exercise. So much so that I believe in the last year or two, there was a meta analysis that was published, or a network meta analysis, that was able to compare the different interventions. So when we're in psychiatry, we often are met with this dichotomy of, do we prescribe medications? Do we do therapy? And it's just kind of simplistic terms. That's kind of what we do. And there was not really a whole lot in between. And what we're seeing is interesting. The evidence base now is that's comparing these treatments shows that their effect on depression is pretty similar. So when you're looking at medications, therapy, exercise, and those are all very broad terms. I acknowledge like there's different types of therapy, there's different types of medication, there's different types of exercise. But across the board, when you're looking at randomized control trial data, the effects or antidepressant effects are pretty much the same, which is reassuring. But again, there's a lot of nuances that we can speak about in between in terms of the differences. And one that I'll quickly highlight is, as I mentioned before, the multi-system benefits of exercise. So again, it's not just treating the depression per se, but it's treating other physical ailments that may be there or bolstering someone's physical reserve that might be there, which has preventative value as well too, which is really, really important.
Absolutely. And before I forget, is there uh, a cumulative effect if you do say, for example, all three?
Mhm. Yeah, for sure. There's lots of evidence to point that these interventions, they don't need to be used in isolation. I think oftentimes what happens is when people hear the word exercise or even diet, for instance, you think that there's these separate camps that you have to be in. That if you're doing exercise, you can't use antidepressants or you can't do therapy, and it couldn't be anything further from the truth. There's smaller trials that are putting them all together as an intervention, but they do show this synergistic effect when you're combining multiple interventions, which I think is an important point to highlight, because if we keep them separate, we create, as I mentioned, these camps of treatment, when in reality it's best to use all of them together, or better phrase that what the patient wants to do or is able to do, it's best to kind of run with that, because that will lead to the best results.
Yeah, Nick, I'm hearing you say this all like this is another opportunity for personalization, like to look
Mhm.
at ways that really suit the patient and what would they would benefit or more likely allow themselves to succeed in. Like if you got somebody that's really keen on moving and less keen on taking something, adding the maybe the therapy plus the exercise might make sense. If they're someone that's not going to get off that couch, then the other two might make more sense. So I
Mhm.
really think that what you're highlighting of allowing us, like using these tools to meet patients where they're at, is huge.
Mhm. Mhm.
Yeah.
And to speak to that point too, I think you bring up a good point indirectly, in the sense that exercise and any intervention for that isn't necessarily appropriate across the board for any illness, but also any stage of illness too. So again, to keep it simple and speaking about depression, sometimes we separate it into mild, moderate, or severe. And as you gave in the example before, someone who's like sitting on the couch, they don't have the energy to get up and eat or even do self care things, it would probably be inappropriate to even suggest, like, hey, you should just get up and exercise, sort of thing. But when we look at different kind of severity levels in depression, and most of the research is based on mild and moderate depression. So, in simplicity's sake, just kind of the people that have these depressive symptoms, but it's not significantly impacting their functional capabilities, that's where exercise may have a role. And even then, to the personalized point, just because someone has mild or moderate doesn't mean that they would want to exercise. But I think our job as a provider is to at least provide them with the education and the option and be able to help them do that, if so that they are interested in taking that path.
100%. Absolutely. Giving that option. And
Hmm.
so what does that look like? And maybe you could reference the studies or what how you might have approached this in your practice.
Hmm.
When they've looked at exercise as something to prescribe, is that weight training? Is it taking a fitness class? Like what does that look like?
So, like we mentioned before, exercise is a very very broad term, right? So, how I like to simplify it is, if you were to prescribe a medication as a doctor, you're going to tell them the medication, you're going to tell them the route they take it, you're going to tell them the frequency, the dose. But as physicians, not to overgeneralize, but oftentimes when you're speaking to a patient, you tell them go exercise, you tell them go for a run. It's not really actionable. So, what we discussed in our paper, and this isn't a framework that we made, but a framework that we've adapted for our paper, it's called the FIT framework. So, it's FITT, and it breaks down exercise into a prescription, for lack of a better word, where F stands for frequency. So, how often you are setting that expectation of working out per week, let's say. I is the intensity. So that can be, a lower intensity, it can be moderate, or it can be a vigorous intensity. The T is the type of exercise. So that's what you were alluding to before with aerobic. So things like running, resistance would be something like weight training, or mind body is something like yoga. And of course, there's stuff in between that, but we keep it in kind of general terms. And then the timing of exercise is, how long are those sessions? So we spoke about frequency, like how often you're going per week. But timing is, how long is that session? Like, are you doing it for 45 minutes? Are you doing it for an hour? And it's important to talk to your patient in these terms, because, again, it breaks it down into something that's actionable, number one. But number two, at follow up appointments, you can have metrics to kind of speak about it. So rather than just saying, how was the running going or something, they're like, oh, I hated that. Like, that was horrible. you can set them up with realistic goals, right? Like you can say, maybe you start at a really low frequency, a really low intensity, and you build up from there. Because the one thing that I like to tell people is that any exercise is better than none for both your physical and mental health. And I'm sure we'll get into it a little bit later, but one of the other things is they've done meta analyses looking at a dose response association between exercise and antidepressive effects. And essentially, how that curve is shaped is those first little bits of exercise, you see an exponential benefit to antidepressant effects, and eventually it tapers off, and can even go the other way if there's too much exercise. But that should be something that's really motivating for people, because even if you're not hitting that quote unquote optimal level, each little bit more that you're doing has so much benefit. And starting low and going slow can be beneficial for someone. It's not that you have to go from not exercising at all to all of a sudden you're running a marathon next week. That's not realistic, and it's going to set yourself up for defeat. But using that fit principle to kind of guide almost increasing the dosage of a medication, similar to what you would do for an antidepressant too. You wouldn't start it at max dose, give them all the side effects, and probably wouldn't tolerate that as well too. So the same principles apply for prescribing exercise.
This is brilliant, because this is one of my biggest pet peeves when it comes to exercise. As clinicians, we often just say, run more, start lifting weights, with no guidance and no ramp up. And I can't agree more with you, Nick, that what people need is wins. So if you're giving them something that is incremental and feasible, and the data is supporting an exponential rise in mood as a result of you making the right steps, that is huge. That's a beast. Like, and as you mentioned before, you're not only just tackling their mental health, you're dealing with this potential side effects with the medication, or they might not be physically healthy. Maybe they're metabolically unhealthy at the same time. So you're addressing those needs too. Killing multiple birds with one stone. So to me, this is definitely on point. So just to elaborate too on the fit method, like what was the results of the study?
Yeah, so for the fit method, that wasn't necessarily a study with an outcome. It was more of a framework in terms of how to apply. And actually, to my knowledge, I don't know that there have been studies in terms of applying the fit principle and seeing the outcome in terms of adherence. And I think that would be beneficial to see, because, in clinical practice, it seems to work, but it's always interesting to see when you put it in the real study setting, does that work? I also acknowledge, though, a caveat to that too is sometimes these RCT settings that we put people in, they're not representative of a real world sample. So you might see false increased adherence. You might see the opposite too. So I think it's interesting, and I'm not aware of literature about the fit principle in terms of its application for adherence and antidepressant effects, but I think it would be interesting to see.
I agree. This would be like on paper, that it definitely sounds like this would be very promising.
Mhm.
So I've been recently uh, been following Chris Palmer. Got to meet him at a couple conferences, and
Mhm.
he was been a big proponent of metabolic disease being a risk factor for mental health.
Mhm.
And I'm curious to hear your point of view and your perspective or your opinion, because when I hear how exercise can be beneficial to improving people's mental health, to me, I directly make a link to this, like the metabolic health side. So,
Mhm.
and this is definitely not something I learned in medical school. So,
Mhm.
I'm just curious, what's your opinion on the metabolic health side and mental health?
Mhm. So yeah, no, I personally know Chris as well too. We're actually working on a paper together too. So he's
Oh,
a
is that
he's a great
right?
guy. Yeah, yeah.
Oh,
So
small world.
yeah,
Okay.
so he I really am interested in the metabolic side of things too, because I do agree that to take I guess one step back, if we're looking at the pathophysiology of depression, like what causes it, we don't actually really know yet. Like in medical school, we're taught like neurotransmitters like serotonin, dopamine, norepinephrine, but we know simplicity wise, it's not causative. Like it's not a drop in serotonin that's causing you to be depressed. There's so many other factors that go into it. And I think we know that there are a lot of bi-directional associations with depression too. And one of the large ones is, these metabolic features that someone may have either as a result of depression or causing the depression. But I think it's at least to say that those metabolic side effects or whatever's going on within that person can really perpetuate those depressive symptoms and make stuff a lot harder. So I think where Chris is coming from in terms of his kind of metabolic origins of the mental illness in general is kind of breaking it down all the way to the mitochondria and saying that this mitochondria is responsible for making energy in simplicity's sake. It's responsible for, all the kind of behaviors and depressive phenotypes and stuff of that sort. And I think there's a lot to learn from a framework. My opinion is that nothing you can kind of simplify it. There's nothing that you can simplify too much down to one mechanism causing depression because it's such a big disorder with so many different causative mechanisms and so many different things. But I do think that you can say that there are significant causative factors. And to go back to the mitochondria, we know that exercise is one of the most beneficial things for your mitochondrial health. And there was also a recent review on how exercise influences your mitochondria. And I can't speak to the specific details there, but nonetheless is just to say that we know that mechanistically exercise can help with the mitochondrial function. And by virtue, we also see changes in antidepressant effects. So one could draw kind of an arrow between those. And I think it's one of the potential mechanisms that could describe the antidepressant effects of exercise. But I think it's also important to reframe it from like a biopsychosocial lens. So that would be the bio side when we're speaking about neurotransmitters, we're speaking about the mitochondrial function. But we also need to talk about the social aspect of it, like exercise. Some people, when they're exercising, you're on a team, you're talking to other people. Even if you go to the gym and you're gymming alone, there's other people there, you're talking to people, you go spot someone. That in itself also has value too, right? And that can result in those psychological benefits. And how I see it is this really big kind of intertwined web where all of these factors impact one another. So as Chris mentioned before, and his theory regarding the mitochondrial health and mental illness, I think is very important within this web. But there's so many different factors that go together into either producing depression or antidepressant effects. And this extends beyond depression too, in terms of other mental illness. But I think it's a very interesting framework, and I think it fits well into this big causal web of depression.
Absolutely. Um, it is a bit of a paradigm shift too, which I think in an area where we there's a lot of people with mental illness, and I feel like it's without knowing the epidemiology, I feel like it's not getting better. But
Mhm.
yeah, so anybody that's kind of looking at it differently, at least, and asking tougher questions, to me, I really I think it should be championed and explored for sure.
Mhm.
So we talked a lot about exercise and depression. I wanted to just get a sense from you if you feel like there's other mental health disorders that are going to be impacted by exercise.
Mhm. I think across the board, there's almost you'd be hard to find a mental health disorder that wouldn't benefit from exercise. But I think just for discussion's sake, and this is not an area of expertise of mine, but something that I've just read a little bit about. If we were to think of kind of one of the more severe mental disorders, even something like schizophrenia, and when I say that, that's someone who may be experiencing symptoms where they're hearing things or seeing things or be very paranoid and have cognitive impairment as a result of that. Exercise even has benefits for a severe mental illness as well too, not to say that it's going to treat all these symptoms and cause someone to be in remission with schizophrenia, but when you think and break it down symptom wise, and there is meta-analyses kind of to show this, we know to speak about cognition first. People with schizophrenia over time, they have an increasing cognitive impairment. And one of the best tools that we have to combat cognitive impairment, schizophrenia, or even other disorders is exercise. Just being able to kind of keep moving and have a healthy lifestyle. So that's one component of it too. The meta-analysis that I'm referring to as well too also looked at the positive and negative symptoms of schizophrenia. And by that I mean positive are the things that are there. So they're either seeing something, hearing something that isn't there. Negative symptoms are the lack thereof. So maybe a very flat affect or lack of motivation. Exercise also showed improvement in those symptoms too. Again, not to the point where you could say no medications are required, but that it's significantly beneficial. And the last point that I want to mention too, that I spoke about depression, but it's even more important here, is the medications we use to treat schizophrenia are oftentimes antipsychotics. And these have huge metabolic burdens on these patients, which are often the reasons for lack of adherence and medication discontinuation. So when I say that, like antidepressants, we're talking about like maybe a few pounds of weight gain sort of thing. Antipsychotics in a year, I've seen people that gain 60 pounds in a year. And that's a lot for anyone to gain. And if you're on that medication and you're gaining this much weight, I don't know anyone that would want to continue that. And not just what you see on the outside too, like in terms of their glycemic control and all these other metabolic markers, it can get really out of control quickly. So I think exercise is a great tool to combat a lot of those metabolic side effects. Again, there are medications we can use like metformin to kind of combat some of that, but sometimes it's best to avoid polypharmacy, and if the patient's willing, to be able to get them into engaging. So I think in summary, there is like utility across the mental disorder spectrum. But if we're looking at kind of at a severity index again for schizophrenia, when we break it down by the symptoms, there's utility for each aspect. And again, not as just a monotherapy, but as an adjunct to current treatment. And I think it also gives patients that sense that they're in control of their own care too, and they're not just being given medications and told what to take, but they're an active member of their care.
Yeah, gives them agency. It's brilliant. I really feel like this is powerful, especially when you hear about one of our most significant mental health disorders and the impact that can have on their positive, negative symptoms. Like that really is powerful. What about anxiety? I like personally, I feel like this would have a significant impact, but just in terms of any evidence to support that.
Yeah, I'm not aware of the specific effect sizes compared to other treatment modalities, but I have read RCTs in terms of anxiety-related symptoms and seeing improvements. And one could just imagine that as well as in terms of with a lot of anxiety disorders, anxiety is there because it's normal to have anxiety as a human being. Like if the example people give is if you're outside and you see a lion, you should probably be a little bit afraid. Like that's normal. But it's when that worry gets out of control, when it's kind of not in your control anymore, when a stimulus that shouldn't cause anxiety is really inducing that. So something like exercise can, benefit some of the things that we discussed before, but it can also serve as almost a sort of exposure therapy to different environments. So say someone's primary anxiety is social related, so it's a social anxiety. Exercise might be a good way to kind of ease into that. So maybe just starting to run and running alone, and then you run into some people on the street, you say hi to some people. That can be a good start. And then all of a sudden you can start going to the gym and there's lots of people there. That can be very overwhelming. And again, it's a similar approach where you don't want to just throw someone in the deep end and say, okay, good luck, have fun. But you can take this a stepped approach. So similar to depression and working your way up. And again, not just acknowledging exercise for the exercise component, but that biopsychosocial model where you can incorporate the social aspect of it too, which may be something that is quite difficult for someone with anxiety, but also important and empowering for them to be able to overcome.
I love this. I love this because it's, once again, to use that term, agency. People can take the power back to a certain degree by incorporating exercise in their lives. Where do you see this going, Nick? Like, I feel like my bias is not everyone's seeing this the same way, and maybe they are. I don't know. You're closer to it, but where do you see this going in terms of therapeutic options for patients?
I think this area will continue to develop. And as I mentioned, beyond exercise, other lifestyle measures, so things like diet and even optimization of sleep, I think will continue to grow. Out of the three fields that I mentioned, exercise is probably the most developed right now, but the other ones are quickly catching up with different RCTs and things like that. I think the issue stems from what we discussed at the beginning of this episode, where we as physicians, regardless of specialty, you are taught that exercise is good for so many conditions, whether it be physical or mental. But speaking for myself, in medical school, I was never taught how to prescribe exercise or how to talk to a patient about getting into it, which I think if we take a bottom up approach, once we have the evidence base for its effect, this should be something that's taught in both medical school and residency to a level where we're able to speak to patients. Like in my psychiatry residency, we do a lot of interviewing techniques, etc., prescribing different drugs. I have a textbook over here beside reading all the mechanisms of different things. But in all these textbooks, we don't really talk about exercise beyond, oh, it's good. Same with diet, oh, it's good. Like, and that doesn't make it conducive for someone to be able to feel confident to talk to a patient about it. And there's been research on that too, not specifically within psychiatry, but looking at family physicians and those who exercise themselves were way more likely to counsel their patients on exercise, and those that didn't weren't. Now, that could reflect their own bias, but it could also reflect just not being comfortable talking about it with a patient, which I think we should leave our training feeling comfortable discussing first line options. And where this goes further for the field of psychiatry, in our current guidelines, so CANMAT guidelines, that we follow, we study for our exams, exercise is actually a monotherapy first line for depression. But when I tell that to a lot of people, people are surprised, like even in psychiatry. So I think we need more. We have the evidence, but we need to spread the word and teach people how to speak to their patients because it is one of the treatment options. Because as I mentioned before, we oftentimes look at treatment from a simple lens of meds or therapy or both. But there's so much more in between. I know we're mostly speaking about exercise, but there's room for optimization of someone's diet. And that goes to the metabolic side as well, too. There's room for optimization of exercise and sleep. And all of these things contribute to the symptoms of depression, schizophrenia, anything. They're all kind of intertwined. And sometimes I think that our approach currently is very much kind of like a band-aid solution where you're giving someone a medication which helps, but doesn't solve the underlying pathology or what might be going on to perpetuate that illness.
Honestly, Nick, I'm finding this conversation so encouraging because one of my concerns in healthcare and medical education right now is we rarely ask ourselves what's the root cause, like what is actually happening, and how can we have non-band-aid solutions to many of our problems. And hearing you speak, it's inspirational. Hearing that as an example, I want to learn how to talk to patients about exercise. Why isn't that part of the curriculum, or as a medical student or as a resident? Even to be honest with you, even as a CME, as a staff doc, I'm not aware of any of this. You gotta come on prevention over prescription to find out. But same, I'm assuming you probably feel similar about nutrition and other areas. Sleep, you mentioned sleep. Oh my God. Like, we're very good at prescribing these medications that don't necessarily help with deep sleep or like restorative sleep, I should say. But I'm hoping your generation and maybe the ones a couple years after you will thrive for this knowledge, because what you're going to see, Nick, in my opinion, is, and I don't have data to support this, but this is just my opinion, is that you're going to get more buy-in. You're going to get way more people that are going to be motivated and feel empowered to use these methods that are lifestyle modifications to impact their illness. I feel that energy coming. I hear it every day. I see it online. I really think it's time. So I hear you in terms of we got some work to do, but man, once we get there, I think it's going to be pretty powerful.
No, I agree. I really agree, and I hope to see that, and I hope to be able to be, at least within Canada, a part to make a difference from that end, and you know, whether it's doing the research or spreading the word, or even just with that individual patient in front of you. I think getting those reps in and being able to feel comfortable talking to them too is so important, because you know, it's one thing to have all this data, but it's another thing to put it into practice, and that's something I hope to be able to do.
And I'm gonna go on the record. We're at the tail end of this, Nick, but I'm gonna go on the
Mhm.
record. I don't like creating more work, but uh, certainly from a research side, I'm always open to collab for sure.
Mhm.
But more importantly, I think hearing your voice, being a Canadian uh, advocate for trying to create these lifestyle changes to help people's mental health. If you want to, if you want some mentorship or some guidance on how to get your word out and building some platforms that people can reach, like get a hold of what you got to say and your research and I think
Mhm.
you should be doing more stuff like this. I
Mhm.
think it could be. I honestly think it could be significant for people's lives. So
Yeah, no, I appreciate it.
I'm opening that door if you ever want to explore that.
No, for
Um,
sure. I really appreciate it. Maybe we could have another chat sometime.
absolutely. So, Nick, how do people get a hold of you? How do people learn more about all the amazing work you're doing?
Yeah, so if the primary thing that I'm active on, I'm just active on X or Twitter. There, I like to post either my own studies or other people's studies. So my handle is just NT Fabiano. So it's NTFABIANO. So if you're interested in just reading studies in a shorter form content, I do that every day there. So yeah.
Amazing. All right, Nick. Future's looking bright, folks. So tap in, follow Nick on X, and brother, thank you so much for joining us on the show. You're doing incredible work, and we're real proud of you.
Thank you for having me.